You may have lost weight before your cloth felt looser, the scale moved down. But there is one type of fat you cannot see in the mirror. You cannot pinch it, and yet it affects almost every organ in your body. It is called visceral fat. And when this hidden fat begins to break down, your body doesn't just lose weight, it starts changing how it works from the inside. Today, we will explain what science says really happens step by step. What is visceral fat? Visceral fat is the deep fat stored around your organs, the liver, heart, pancreas, and intestines. According to the World Health Organization (WHO) and the National Institutes of Health, excess visceral fat is linked to chronic inflammation, insulin resistance, type 2 diabetes, heart disease, fatty liver disease. Unlike fat under the skin, visceral fat is biologically active. It releases hormones and inflammatory chemicals that affect the whole body. Why the body targets visceral fat first? When the body senses a temporary energy shortage, such as during fasting, calorie reduction, or increased energy use, it sends chemical signals inside cells. Research from the NIH suggests that visceral fat responds quickly because it sits close to major blood vessels. It is highly sensitive to hormones like insulin and stress hormones. It releases stored energy faster than other fat types. In simple terms, visceral fat is easier for the body to access. What happens when visceral fat starts breaking down? As visceral fat cells release stored fat, free fatty acids enter the bloodstream. These fatty acids are used as fuel by the liver, muscle, and heart. This process signals the body to shift from sugar-based energy to fat-based energy. According to the NIH and CDC, this shift may support better metabolic flexibility over time. Hormonal changes that may occur as visceral fat decreases. Research suggests several hormonal systems may function more efficiently. Insulin sensitivity may improve, helping cells respond better to glucose. Leptin signaling, which affects fullness, may become clearer. Stress hormones levels like cortisol may stabilize as inflammation reduces. The CDC notes that chronic inflammations from excess visceral fat plays a role in hormone disruption. Reducing that inflammation can help restore balance, but results vary by individual. The liver's role in this process. The liver is the first organ to process fat released from visceral stores. Studies published by the NIH show that during fat metabolism, liver fat oxidation enzymes increase. Ketone production may rise during fasting states. Fatty liver markers may improve in some individuals. A 2023 clinical study from Washington University School of Medicine observed that participants practicing time-restricted eating showed reduced liver fat markers over several weeks. This does not mean fasting threats disease, but it suggests the liver can adapt positively under certain conditions. Inflammation begins to cool down. Visceral fat releases inflammatory chemicals like TNF-alpha and IL-6. According to the WHO and NIH, high levels of these markers are linked to blood vessel damage, insulin resistance, cardiovascular stress. Research from the Karolinska Institute, Sweden, found that reducing visceral fat was associated with lower C-reactive protein (CRP) levels, a key inflammation marker. Low inflammation allows the body to shift from constant defense mode to repair mode. What about detox and temporary symptoms? Fat tissues can store environmental substances over time. When fat breaks down, these compounds are released and processed by the liver, kidneys, lymphatic system. Health organizations note this may cause temporary fatigue or discomfort in some people. This is not medical advice, just an explanation of why changes may feel uncomfortable at first. Anyone with symptoms should consult a healthcare professional. Gut health and the brain connection. As inflammation decreases, the gut environment may improve. Research from NIH and Harvard Medical School shows that beneficial gut bacteria support digestion. The gut produces a large portion of serotonin. Inflammation can disrupt gut-brain signal. When visceral fat reduces, this system may function more smoothly, supporting mood and mental clarity. Heart and blood sugar support. The American Heart Association reports that excess visceral fat is strongly linked to high blood pressure, abnormal cholesterol levels, increased cardiovascular risk. Studies suggest that even modest reduction in visceral fat are associated with improved lipid profiles and blood sugar regulation. This is not a guarantee, but it explains why doctors focus on waist size, not just body weight. Long-term metabolic flexibility. One key benefit researchers discuss is metabolic flexibility. This means the body can use glucose when available, switch to fat when needed, avoid energy crashes. According to NIH, metabolic flexibility is a marker of overall metabolic health. It supports energy balance but does not replace healthy lifestyle habits. Important disclaimer, clear and ethical. Everything discussed here is general educational information. It does not replace medical advice. It does not treat or cure disease. Individual results vary. Thus, always consult a qualified healthcare professional before making major dietary or fasting changes. Visceral fat is not just about appearance. It affects inflammations, hormones, organs, and long-term health. When it begins to decrease, your body may regain balance, not through force, but through biology doing what it evolved to do. Understanding this process helps you work with your body, not against it. If this video helped you understand your health better, consider subscribing for more science-based, evidence-driven content. Because knowledge, not fear, is the first step toward better health.